Hello again. Welcome to the second edition of the Fertile Foundation's How to Explain the Unexplained Infertility. So this is for women and couples going through the fertility process that have been passed from pill to post and still lack some clarity in regards to what's going on and why. And what I want to do within this webinar series over the course of these 3 weeks is help you to better dissect and understand your physical self, what could be going on in those subclinical parameters, but equally how we can better understand the whole fertility process, and hopefully glean some insight in regards to those currently unexplained factors. So in this particular week, I really want to go into something I'm really passionate about, and that's male factor fertility. Now, you might wonder why, if I work specifically with women's health, that this is something that I'm so passionate about. One of the reasons being is because with fertility medicine, actually, it's the only area of medicine that women are treated for male factor issues. And this frustrates me like anything. I would use stronger words, but I don't think it's appropriate currently, although I'm sure some patients have heard me say these stronger words in treatment. But the principle is that what we don't know about male factor fertility and also sperm health is a great deal. So what happens is men usually go for a sperm sample, and this is a generic single sperm sample at the beginning of a fertility journey, or 1 or 2 years in, and then they're told that they go away and they're told that they have super sperm. Now, in actual fact, what this is just a tiny snapshot of your cellular health at that time. So your sperm are the smallest cell in the body. So not saying your sperm specifically, obviously your partner's sperm is the smallest cell in the human body. And actually, it's just like taking any other sample from us as well. It's like taking a swab from the vaginal canal, or it's like taking a blood sample. That is subject to change constantly based on our external environment and those things that influence us, but also the things that we're putting into our body, be it medications, supplements, diet. Any of those things will actively transform and change the quality of that cell at that particular time. Now, sperm in that instance is no different. So why is it that we are only doing a single sperm sample, then the male is sort of being dismissed as it being absolutely categorically not male factor, sending the woman down into this spiral of over-treatment, over-medicated, and undergoing invasive and very expensive treatments that are actually entirely unnecessary. So part of this 3-part series, Explaining the Unexplained, has to have a huge focus on sperm health and male factor infertility, given all of this. I want to be able to release the weight of expectation and the obligation that women go through in this whole fertility process simply by looking at 50% of the whole in regards to you obviously actively trying to conceive. Because we could do everything that we can for you as a woman, but if we're not addressing the male factor, we're missing 50% of that entire picture. And that's massive, that's huge. And I just want to go into some more recent statistics. So these are the most up-to-date statistics that I could find that have been recently published this year. And it stipulates actually that male factor is accounting for 34.6% of this entire picture that is looking at infertility now. And this is huge. This is growing much, much more as diagnostics from a male factor perspective are growing and increasing as well. So I want to highlight here that at the moment, there is inadequate support for men going through the fertility process. They're often dismissed as absolutely A-okay for no reason. And then that sends us into a spiral of overdiagnosis with women as well. This is one of the biggest reasons for that unexplained diagnosis. And what I want to do is, in this particular webinar, is just dissect that in more detail. So why is this sperm analysis, the simple sperm analysis, inadequate? What else can we be looking at? What other reasons could there be that are contributing towards male factor infertility and the increase in male factor infertility as well? And what can men be doing about it? So often it's the case that when I've done a presentation like this, patients have got their partners to watch this alongside them. I highly recommend that that's something that they do. And if you don't carry on watching this, you'll have got a great deal of benefit just from this past 5 minutes of us talking. And I hope that this highlights everything and more that really we need to be looking at doing and addressing from both parts of that fertility process as well, both male and female. So as I said, here are some more recent statistics around about how heavily weighted that male factor is now when it comes to subfertility. One, and I have to highlight here as well, because I hear this all the time with patients, is that doctors saying that their partner is being dismissed again as there even being a potential of male factor issues because they already have a partner. Now, that's absolute nonsense. As I mentioned before, sperm is subject to change. It's the smallest cell in the body. It's subject to change just like every other cell in our body as well. There is no reason to say that if you have had a child already, you will absolutely 100% be able to get pregnant the second time round or the third, and that dismiss male factor completely. So it's something that really, really strongly needs investigating, because actually male factor is one of the biggest causes of secondary subfertility. It's nearly as common as female secondary infertility, and predominantly due to varicocele or low testosterone. Again, these things may not have been a problem before, but could very well be a problem now. So they have to be looked at, they have to be addressed. For this reason, I've dissected this webinar into 3 parts. This is the male fertility part. We obviously had the first part looking at female subfertility and the primary causes for that, looking at things like hidden inflammation, but this is all for men, or all about men. Okay, so again, what I want to highlight here is that infertility or unexplained infertility is a controversial diagnosis, and it's actually accounted for now for over 35% of couples. And Eshre, so the leading governing body essentially, and the holy guru of European gynecological and fertility support called Eshre, they have stipulated last year that this is a controversial diagnosis and the diagnostic workup still is lacking. So what we need to do here and what we need to highlight is the fact that that needs to be further investigations. What does that look like? We'll be looking into that in more detail. So here are the biggest, the big 9. So with women, we have the big 10. With men, we've got the big 9, looking at reasons why obviously male infertility is occurring. So here you can see that there are actual structural problems, things like varicocele. And if you don't know what varicocele is, it's basically like a varicose vein on the testes. And what this does, it creates a great deal of heat and inflammation in the testes, and this can damage the sperm. So that's something that is often overlooked, as doctors don't usually get hands-on with men and look at their testes when they're actually going through a fertility workup. Things like hypogonadism, again, that can be done through, looked at in hormone profiles and hormone tests. Your immune system, this is massively overlooked in men. We've got a whole category of immune factors that influence women's fertility, looking at things like reproductive immunology, but it's often overlooked in men. And this, again, there needs to be more research, more evidence, but it's definitely a significant factor with regards to male infertility issues. Looking at things like sexual dysfunction as well, of course, there are reasons behind that. too that need investigating and sorting. Systemic disease, so looking at congenital issues and hereditary issues, things like diabetes, thyroid problems, those types of big issues going on there as well. Infections, so there we're looking at things like STIs that perhaps haven't been addressed, or other issues like ureaplasma, mycoplasma that can be passed also between couples, or other issues, other infections that are related to the urogenital tract as well. Undescended testes, this can happen at any point, that again perhaps they haven't been addressed when they were younger, and that's caused ongoing problems later on in life. And then the primary factor here, so when we actually look at all this broken down into a nice little chart, the unexplained category is actually one of the biggest categories in there, accounting for nearly 40% of all subfertility issues within male factor. So there is this huge area in male fertility medicine that's actually being undiagnosed or not looked at in any great depth. Just that, like we mentioned last week, this is the case for men too, that often for this reason, this unexplained category falls out of those clinical parameters. So what I mean by that is clinical parameters, we're looking at medicating or having some surgical intervention. But actually what happens when people are kind of at one end or the other, but don't fall within those clinical parameters that we go to the GP for, and then they come back and they say everything's normal. We're looking at those functional parameters. So actually where we sit within that functional range, that normal range, and the ratios between everything as well. And this can account massively for those unexplained factors. This applies equal to the fertility factor and also the male factor. These things need to be addressed and looked at in greater depth. So in case you are coming to us today and you aren't a patient of mine, then I just want to introduce myself briefly. Obviously, I'm Kimberly Shepherd. I'm a fertility support expert and lead acupuncturist and clinical director at Life and Lemons Acupuncture Clinic. My biggest passion is to help you explain the unexplained in your pelvic pain and also your unexplained infertility. And this is where I've come at acupuncture from, is from my own personal journey in this area as well. So I fully empathize and I fully resonate with where you're at. And I just want to help more women maneuver through this with greater clarity and greater certainty to facilitate hope and being comfortable and confident again within your own body. Okie dokes. So what we're looking at now is actually the sperm analysis I mentioned briefly before, that there are certain pros and cons with this. This is in the NHS the gold standard of looking at sperm health, but there are significant issues with this. Not only, as I mentioned before, is this just a snapshot of the time of sperm health. So again, doesn't give a great indicator in regards to what that's doing over a period of time, if it's consistently good or consistently bad. But actually, what it's only looking at is how sperm are getting from A to B. So you're looking at the big three here, big four, should we say. You're looking at morphology, how the sperm looks from the outside, if it looks normal, should we say. We're looking at motility, so how sperm is getting from A to B. And we're looking at the number as well. So how many are there in relation to all of those factors? Plus, we're also looking at the semen as well. So what the liquid or the viscous substance essentially that the sperm is being transported in. And that we're looking at the pH and if it's cloudy and this and the other. So that's what you generally see in your normal sperm analysis that you get from the GP. As I said, though, this only looks at how sperm are getting from A to B. What we need to do is look at the quality of the sperm. So actually, what is being delivered to the egg, not just how it's being delivered to the egg. Okie dokes. So below is how sperm health looks. So you can see how much this changes day in, day out. And for this reason, as I mentioned, sperm analysis can be relatively inaccurate and not provide a true reflection of sperm health. So this makes it really, really difficult to actually plan your fertility journey. Whereas something like that internal package, what we call the DNA, is that always stays the same, although we can support it in various ways if it's not as optimal as we'd like. So what is this little package that's being delivered to the sperm? As I mentioned, this is your DNA. So this is the genetic makeup that is being delivered to the egg, and that's going to make up obviously half of the whole when it comes to the growth and development of that baby. So it helps us by looking at DNA, it can help us to provide not just answers in regards to explaining the unexplained, but also looking at things like recurrent miscarriage as well. So we know that there are issues when it comes to recurrent miscarriage, and particularly unexplained recurrent miscarriage, when actually it's not about the woman necessarily, or it could be a combination of the two, but there is a huge sperm factor issue that's going on here. It's the DNA that is what they call fragmented, so not as optimal as it possibly could be, that's affecting the way that egg is growing and developing at that particular point, that embryo is growing and developing. Okay, so this DNA fragmentation is now internationally recognized by Eshre, that governing body that we mentioned before, and it's considered to be the gold standard. So the guidelines, they stipulate there needs to be more complex testing required for couples with recurrent pregnancy loss and men with unexplained infertility. In these patients, there is evidence that sperm DNA may be damaged. And that's from Eshre themselves, and that was in their report in 2022. So it's the most up-to-date report we have on fertility support and diagnostics. So as I said, when we're looking at things like the gold standard, we're actually looking at this is just an article about how significant DNA fragmentation is when it comes to male factor infertility. And these are the Eshre guidelines. So what can cause DNA fragmentation? So what can affect the quality of that internal package that is being delivered to the egg that's going to then go on to become a beautiful baby? The biggest thing is heat. Or one of the biggest things, should we say, is heat. And the reason the testes are on, this is the reason why the testes are on the outside of the body, to keep the sperm cool. So one condition that raises the heat is, as I mentioned before, it's called a varicocele, and this is that little varicose vein on the scrotum. 40% of infertile men have them. They're the primary cause for subfertility, but 80% of men with secondary fertility problems also have varicocele. So this can be something that is left to be normalized by a man, as they might not even recognize it to be something that is an issue for them. If it becomes more of a problem, then they might start experiencing pain around there, just as you would with, again, a varicose vein on your leg, for example, as that vascular component becomes more swollen and inflamed. So that's really the only way that they would know, obviously, unless you checked directly and visually, you could or would be able to see them. But the best thing to do is get hands on with the doctor to double check exactly if there's anything going on from that perspective. So below shows the benefits of varicocele remains on pregnancy, it improves semen, and it improves DNA. So semen obviously being the liquid that is transports the sperm as well. It also improves DNA. Other impacts that could impact obviously sperm and cause heat and inflammation is infection. Okay. So the facts, what do we know? We know 40% of couples with unexplained infertility have high DNA fragmentation. And I have to say that every patient that I refer on to get their DNA frag tested that have unexplained infertility or have had recurrent miscarriage, 100% of those people have come back with high DNA fragmentation as a reflection. But again, this has gone on to be supported with significant outcomes to pregnancy outcomes ultimately. And this is why it's so important to have a test, even if the semen's looking normal. So you can have high DNA frag, even if your generic sperm samples come back as normal from your GP. So sperm DNA damage doubles the likelihood of miscarriage. Again, one of the biggest reasons why we have to look at male factor, and it's not just all about the woman. So don't get fobbed off with it being, if you've had one, I would go so far as to say if you've had one miscarriage, look at male factor. And we can give you the details of someone that we could refer you to should this feel like something you wanted to do, look into in great depth. Okay, so IVF live birth rates decrease sharply as the level of sperm DNA frag increases. 30% of women that go through ICSI are in ICSI being the particular style of IVF used for male factor problems. 30% of women that go through ICSI are entirely fertile. This is one of the only areas of medicine where women are treated for male factor issues, as I mentioned before. ICSI is extraordinarily expensive and only works 25% of the time. So this is one of the reasons why I place so much importance on fixing the problem before you even think about or embark on that. So what can we do when the consultant says doing DNA fragmentation is pointless and that ICSI is the only way? This is something that I cover with a video that I've done with Brian Woodward, who's an andrologist that we work closely with. He is an amazing man who answers this question in great detail. So please do watch that video before going ahead and doing ICSI. ICSI is fine, but there is an emerging body of data saying that poor DNA quality leads to problems in childhood health and development with neurodegenerative disease, autism, for example, childhood leukemias, etc. So instead, this is one of the reasons why I highly recommend trying to fix the problem beforehand. So one of the benefits of treating men specifically, is that their spermogenesis, the time in which it takes for sperm to regenerate, is just 90 days. So it's much less than it takes us as women for our follicles to grow and develop. So for that reason, we can actually do a lot to change the quality of the sperm, including the sperm, what it looks like from the outside, but also what it looks like on the inside. So there's lots of things that we can do to support overall sperm health. So high DNA damage can lead to things like increased risk of infertility. It can lower success rates of IVF, and it can increase risk of miscarriage. The effects of certain mutations, we look beyond what we do is look beyond the positive pregnancy test and consider long-term outcomes of future generations. So there's a really great book called, I'll I'll have to I'll have to drop you some details of that book. But it's specifically all about sperm health and male fertility, and how we can improve it, but also how much it's being affected by our external environment. Poor sperm quality is said to have an impact on children, as I mentioned before as well. So again, even more reason to work on your preconception health from the both of you, instead of just jumping straight into something that's expensive and invasive, such as IVF or ICSI. So we're looking at things like miscarriage. Below, we can see the benefits of varicocele, and how it improves semen analysis and improves DNA damage. So again, this is surgical intervention, working with things like varicocele. But if you look at this chart, just look how significant that changes as a consequence of having that varicocele addressed. So the exact test. This is something that we do in clinic. You might have heard of it as the sperm comet test. It looks at sperm DNA fragmentation in greater depth and can highlight whether or not there's lots of stuff that you can be doing, or if there's no support that can be offered, and then go straight on to ICSI itself. It's much more than just a diagnostic tool. It's an opportunity to minimize the risk of adverse health outcomes for the baby, and it's about the health of the next generation. And this was from Professor John Aitken. Okay. So exact IVF identifies normospermic. I can never pronounce that. Why do they have to be such long words when it comes to male factor issues? Men with an increased risk of IVF failure due to high levels of sperm DNA damage. This is the only sperm test that is predictive of IVF fertilization rates, embryo and blastocyst quality, implantation rates, pregnancy rate, and live birth rate. Exact miscarriage, as a separate test, looks at the close relationship between DNA damage and sporadic recurrent miscarriage. Sperm DNA damage can be improved by medical and surgical interventions, as I mentioned before, such as varicocele repair or treating underlying infections. So I wanted to highlight here what I am now doing and what I'm now offering that can help both men and women. So this is called the Fertile Foundation Support Program, and it's a 4-step approach to fertility foundations from soil to seed. So within this, we look at the soil, which is ultimately that external environment, and our internal environment, and how we can optimize that health to support your preconception care, ultimately from a male and female factor perspective. We also look, so what we do is take those raw ingredients and add a little drizzle on there as well, to take you from fertility overwhelm to planting seeds of hope along the way. Regain that confidence and comfort back in your body. The idea and intention is to lead you through this process of insight and knowledge. So it's a learning process about your body, to help you become your own hormone detective, to help you identify those areas that are impacting your health and your fertile potential that is feeding into this unexplained diagnosis. What this is going to look like is not just recommendations that's going to help with that. So looking at things like diet, lifestyle, those things that we expose ourselves to from an external environment, and how that can impact that delicate, fertile soil within our body that is so prone to damage, as we can see with that, with those sperm samples. But what we're going to be looking at too is how, from a diagnostics perspective, we can actually start to bang on the right doors and finally get some answers. So if there is something to be uncovered, we're going to help you find a way to uncover it and understand what's going on, so we can help either refer you on to the most relevant help, or we can help to direct you in regards to very specific advice that's going to help you on those next steps in your fertility journey. So as I mentioned last time, so much of that fertile soil is orientated around cleaning your tank. So we mentioned before that this is what we call your inner terrain. What we're not looking to do is just medicate. And again, we see this all the time in fertility medicine, is that women are prescribed and given so many medications when actually it's the case that it could very well be male factor, or it could very well be your terrain. So that in a soil, or that inner water in the fish tank analogy, metaphor, that just needs changing. And we're there to help you change that water so that you not just have a healthy pregnancy, but also a healthy baby at the end as well. So some final tips from a male factor perspective is that we are looking at things like lifestyle changes, smoking cessation, weight loss, where necessary. And I'm not talking about BMI, just to be really, really clear. Antioxidants to help support your DNA frag and to reduce any free radicals that are causing some havoc in there. We want shorter abstinence periods so the sperm has the opportunity to recycle and regenerate, so the old stuff doesn't get stuck and clogged down anywhere. And looking at things like varicocele repair and surgically retrieved sperm, should that be something that's absolutely necessary. So I want you to drop me an email should you have any questions about this particular topic. I really want to help you, support you through these next steps if you have been diagnosed with unexplained fertility or unexplained recurrent miscarriage, because so much of this can be explained or explored, and so you start to feel more confidence in your body, so you actually start to feel heard, and so that you also feel like you've got someone walking with you on that journey as well. So please do drop me any questions. I'll do what I can to answer them where I can. I'd love to hear from you. These are some of the common questions that we have here. I just wanted to go through some of them with you in case they are something that that crop up as well, in case you had them as questions, should we say. So one of the biggest questions is male infertility a new thing? Well, it's absolutely not a new thing. It's always been there, but historically women have had their children a lot younger, so we're able to compensate for the male defects. And this is something that's really amazing about women, is that our body actually has the capacity to change for the benefit some poor sperm, basically. So if there's lots and lots of poor sperm and our body is really, really vital, then we can change some. So not all. If it's really significant, then it's not going to ever change massively. But it does have that capacity, which I think is astounding. I think women's bodies are amazing. Also, men aren't subject to men also have a biological clock. So aging is absolutely a factor. For men over 40, fertility is impacted, and in particular DNA. But nobody knows what normal for age is, as everyone is different. Young eggs, as I said, can help repair DNA. Why can you, looking at further support, if you do need further support, there's lots of information out there. We can send you through some details about this as well. So looking at things like why do the test? This is something I spoke, as I mentioned, with Brian, the andrologist that we work with, about. So why bother doing ICSI? Why bother working with the quality of your sperm if you're going to be doing ICSI anyway. So some of your fertility consultants might say that to you. So ICSI is fine, but there's an emerging body of data saying poor DNA quality leads to problems in childhood, as I mentioned before. So there are neurodegenerative issues, such as autism, for example. So it's far, far better to work with the male factor problem before obviously going through ICSI. Brian says that it's better to go in prepared for something like ICSI, where they cherry pick the sperm, and because there'll be far more sperm to choose from that are a really good quality. So it's better to go in prepared for that reason. So this is the book that I was referring to before that's great if you wanted to read about any of this information further. It's by Shanna H. Swan and it's called Countdown. So it's really, really interesting and about how there's a significant decline in male factor fertility currently and how we're actually heading towards huge consequences from a global perspective, and why this is, and what we can do about it. She's an amazing, amazing woman. So please do read that if you get the chance. Okay, so I'm going to end there today. As I said, if you've got any questions, please do get back to me, email me, drop me a message. And next week, we're going to be looking at one of the other biggest factors, the third and final factor in explaining the unexplained. We're looking at the vaginal microbiome and the microbiome in general as a means of explaining how that can impact our overall physical fertile potential. So please tune in and drop me a message if you've got any questions beforehand. Thank you for joining me today.